All right, everybody. Well, it's 12:01 and we know that we all have busy schedules and some of you are taking time out of your lunch hour to join us today, and I just want to say I appreciate you for doing that. Um, we are here to talk about tackling workforce challenges through recruitment and retention. Our office has been coordinating what we call community conversation webinars, and we've been hosting them bi-monthly. These sessions are meant to, one, engage with you, our partners, and two, to share information and, of course, to learn from each other, because without sharing, what we all know among each other, then our knowledge just isn't allowed to keep growing and growing. Today I am joined by my partner, Bill Funder, Incentive Programs Manager. Bill has been with the Oregon Office of Rural Health for over 10 years, and he plays a very critical role in supporting and growing our incentive programs. And Bill will be presenting a little bit later in our presentation today. The presentation is being recorded and will be shared on our website and some of our other social media accounts. Typically within 1 to 2 days, we'll have that information available to you. So if you have coworkers that maybe didn't get a chance to listen to the presentation live, they can listen to it after the fact. Also, before we get started, audio has been muted and the chat feature is live. I encourage you to utilize the chat feature to submit your questions during the presentation or towards the end of the presentation, whichever is your preference. We are happy to take them as we go along. All right, so the Oregon Office of Rural Health was created in 1979, and it is housed by OHSU. A lot of times what you typically will find, your rural office is either housed by a medical health educational institution, or it can also be housed within your primary care offices. Our office has a number of different services that we align under, and that is workforce services, field services, which they offer data and analysis, technical assistance to rural health clinics, critical access hospitals, as well as quality initiatives. And then we also work on development and advocacy as well. I wanted to share this little snippet from our brochure, which talks about what is considered rural. There are times when I speak to sites, they're not sure, are we considered rural? Are we considered underserved? Can you work with us if we're not particularly in a rural organization? And this is what I say, yes, we can work with you. Please reach out to our office. Don't ever hesitate. I work with organizations in rural settings, frontier settings, urban settings. We recognize that there are underserved areas across our state in all areas. All right, so how do we tackle workforce challenges with recruitment and retention? Well, one, you can partner with our office. We are a nonprofit. We are a nonprofit organization. We offer recruitment and retention services. We work with employers like yourself, and our goal is trying to find the ideal healthcare candidate to fill your position for the long term and not for the short term. And so it's important that when we have an opportunity to visit with candidates, we like to share information about your sites, your organizations, and we also like to learn about them as well to make sure we make a good match. We also are a good source to primary care providers and students that are currently in educational programs here within the state of Oregon and without outside of the state of Oregon that have an interest in coming to work within our state. We believe in rural Oregon that that is where opportunity knocks. All right, so there's a number of different recruitment and retention technical services that our office can provide. We can work with you in providing a practice site assessment. We can help you developing practice profiles. We offer assistance with development of a recruitment and retention plan, which is going to be our focus on today. We can also assist you in facilitating the marketing of your current job opportunities by utilizing our own sources, advertising your opportunities on our website, on our social media platforms. And then we also are the organization that works directly with 3RNet, which we'll talk about that a little bit later in the presentation. We provide referrals to health professional candidates who have expressed in job opportunities matching your facility. All right, so developing a recruitment and retention plan. That is probably the biggest area of focus that an organization should take when they are looking at how they can tackle their recruitment and retention areas. We know that recruiting in rural areas and the loss of one single professional can impact the healthcare community quite extensively. And we've seen that here within our own state of communities, you know, that lost a very important provider, and it left a huge detriment in the community and the organization. So with developing a recruitment and retention plan, it is important to assess and define your needs. And that is defining those needs that are in the past, those positions that maybe you haven't filled, that you're struggling with filling in the present, that immediate notice of someone leaving the organization, and of course the future, the succession planning of those providers that may be nearing retirement. It is important to develop a recruitment team and defining what that team is constructed of, defining your opportunity and those unique selling points, which we'll talk a little bit more about in the presentation. Developing a budget, that's always important, and defining your marketing plan, and of course retaining for the life cycle of the recruit. And that is the retention plan. And I found this little funny sticker that in the HR world, it says, why don't we just recruit people who stay? It feels like at times we're in a continual cycle of going around and around, and we understand those frustrations. All right, so let's talk a little bit about assessing and defining your needs. It's important, very critical to, for your organization to take a step back and do a provider assessment. A successful recruitment plan is very important, and it can help you anticipate your current needs of the organization as well as the future needs of the organization and the community. By conducting a thorough needs analysis, your healthcare organization can ensure that your physician recruitment strategies are targeted towards those very specific needs. And there's a lot of great resources out there that can help you. Some tools that are out there that can help you formulate an assessment, a provider assessment, and then also help you formulate a community assessment, as that's important as well. Understanding the community needs, the present and the future needs of the community. A community need will help you understand your population's current and future healthcare needs, and this data will help you evaluate what key information you need to fill the gaps of care, increase those medical specialties that are in demand for your organization, and it'll also help you with some of those strategies to fill those needs in the community. The recruitment team. So It is very important to have a recruitment team rather than just one individual holding that responsibility. And a lot of times, you know, in our smaller rural organizations, I understand that there may be only one or two people that are directly focused on recruiting HR efforts. And so when we start to look at a recruitment team, look beyond just those individuals. Your core members should include obviously the recruiter, an HR partner, your leadership team, your CEO, your COO should be a critical member of that team, and also the community. Incorporating your community members into that recruitment team will help bring future success and stabilize success in those recruitment efforts. And when you develop that team, you know, identify who's in charge of what process, delegate those tasks and what responsibility each person has. We have to look outside of our own institution on that recruitment team. Incorporate members of your Chamber of Commerce, your City Council. Meet with members of your Realtor Association. Um, Involve members of your school district, especially when you're talking with candidates, you know, that have family and have children, and those are very important aspects. Grow your partnership with your community college and the programs that they offer. All of those intricate, important pieces within your community will help play a big role in your recruitment team and recruitment efforts. And also think about outside of just that initial recruitment effort. Um, you've had the chance to visit with a candidate. This candidate is coming out for a site visit. Who's involved with that site visit? What does that site visit look like? What things are we going to put in place for the candidate, the practitioner, and then also for the family or the spouse? Those are all very important pieces. When I was working for a critical access hospital and recruiting for that organization, a lot of times our recruitment visits were over a 2-day period. Especially we were in a more rural community, so it took longer for somebody, you know, to fly out to our organization and have time to visit and see the community. And a lot of times we would incorporate a 2-day site visit, which, you know, you have a day of travel, you have a day of spending time with the organization, and then we added a day to allow the provider and whoever they were visiting with time in the community, you know, to do some sightseeing and visit some properties, meet with a realtor, just really get a good glimpse of what it would be like to work, you know, with that organization and community. All right, practice profile development. This is probably another big area of focus. There are 3 components when we look at developing our practice profiles. That's obviously opportunity description, candidate qualifications, as well as a community description. While most practice opportunities do include these components, it's important that we set apart unique selling points for your organization. Um, Unique selling points, you know, are very particular, unique things about your facility, about your community, maybe about your compensation benefit package. Remember your job description or your opportunity posting is typically the first thing a provider is going to look at. And a lot of times a provider doesn't want to look at just a standard job description, you know, the HR document. So look at developing your practice profile differently. put on the lens of the provider and how they would like to see it. Include that type of document as a link to the practice profile rather than just a standard job description. Ask yourself, why do I work here? Why do we work here? This is one of the organizations I work with on 3RNet, Orchid Health. I just wanted to show a glimpse of how they did their job posting. They identified it's a behavioral health opportunity in the charming community of Oak Ridge. Job details right away. They're capturing that they offer a great work environment, work flexibility, and pay, including a sign-on bonus. And as you can see at Orchid Health, they included a link so that way the provider could have a quick access, go directly to Orchid Health and really learn more about that employer and opportunity. Sarah, are we doing good? No questions? I'm not missing anything?
Yes, we are. There are no questions right now,
Okay, great, great.
but definitely put them in the chat if you have them.
Okay, all right, thank you. All right, let's talk about unique selling points. This is probably one of my biggest favorite things when I get to work with sites and helping them develop, their practice profiles and their unique selling points. Each of us live in an area that offers something unique and different. And each of us work in an organization that offers something unique and different. And utilize those. As small and in between as you might think they are, utilize those to showcase your organization. Some of the points you can highlight are maybe you offer great career development and growth opportunities, flexibility in your schedule. Maybe your community has a great pool and recreation center. You're in an area that has easy access to recreational opportunities, great climate, all of those different things. I wanted to showcase a couple of things here of organizations I come across that have some great programs that they offer. Yakima Valley Farm Workers, they have a Spanish immersion course that they offer to their new providers that they recruit to their organization. They service a high migrant health population and Hispanic population. Port of Morrow out of Boardman, Oregon, I see they offer two unique benefits to be an employee there. They have discount memberships for their employers to their community rec center and pool center. These are all little ideas of ways you can engage your community and what is being offered in the community to offer unique selling points or unique benefits to your staff and your team. Just different ways to look at how we can showcase the opportunity, the organization, and the community, of course. All right, budgeting. That's probably everybody's hated thing in the world. Budgeting, nobody likes budget time. We're nearing the end of budgeting in our own organization, but budgeting is very important. It's very critical. You need to know your cost and you need to make strong strategic decisions. When thinking of a budget around recruitment, consider including costs for your promotion and publicity items, the direct marketing materials, candidate screening tools that you may be using, additional cost when it comes to personnel, your HR team, costs that it may be associated with attending job fairs, within the state or without the state, with outside of the state. Sorry about that. Signing bonus, moving allowance, legal cost, for contract development and negotiations, and as well as retention activities should be, built into your budgeting as well. Formulating compensation surveys, that has an expense to it. Succession planning, turnover analysis, employee recognition programs. You know, what social events do you coordinate with your employees, and do you do an annual Christmas party, you know, annual events like that? That could all be incorporated into your budget for recruitment and retention. And again, we'll talk a little bit about 3RNet down the road, but they have some really great resources online that you can access that has a lot of good tools and strategic tips on improving rural recruitment and retention. All right, marketing. Marketing is another big and important piece. As we all know, everything is on the web now, and the virtual space is where we all go to learn information instantly. It's readily available to you. And so it's important that we be transparent and that we share our culture, our community, and our mission, and that we have a presence of that across all platforms our organization is utilizing. Um, and make use of your social media platforms. I encourage the sites that I do work with, you know, share your job opportunities on your Facebook page, share it on your Instagram page. I encourage LinkedIn. If you don't have a LinkedIn page for your organization, create one. That's another highly utilized area that professionals will go to seek information as well. Make sure your health center is connected to potential recruits with that internet presence, especially as our AHEC scholars are coming upon graduation soon. They're starting to go to the internet to see, you know, what different opportunities are available. And also the social media, it is a way to share information about our community, how we're interacting with our communities, and what activities we're doing. I wanted to share a couple of just quick links here of sites around the state that I found that have some good utilization of their social media platforms and their community activities. Good Shepherd Medical Center is doing a community memorial service with the live butterfly release. That's wonderful. They have this all over their social media platforms. And this is another way it's showing that community involvement focus. Southern Coos Hospital celebrating National Hospital Week with their Chamber of Commerce. Super proud of that. Another good utilization of those social media platforms. On social media, I don't know, is too much ever too much? I'm not sure. I want to shout out also to Columbia Memorial Hospital. They have a provider opportunity focus page, and I thought that was great as well. You know, an individualized page that me as a provider can go to and see what opportunities are available. You know, these are other things you can think of to add to your marketing, your website presence. Yeah, a lot of good efforts across the state and across the nation, and just keep working on those. All right, and of course, recruiting for the retention. 3RNet has this saying they call it recruit tension, recruiting for the intention of retaining, and that really is that's our primary focus. And you know, a lot of times we get focused more on the recruiting than on the retention piece, and it's easy to do that. When I, you know, was working for the critical access hospital, there were times it was hard to not just focus on, I have a candidate, they're interested, look at their CV shows they're qualified, move forward. But we have to look sometimes beyond the CV. And I say that because the CV is important, and their education and training and experience is important, but also it's important how well they're going to fit in to the community and the organization, because without evaluating those areas as well, that retention of that recruitment may not be where we want it to be, and that's for the long term. So when developing a retention plan, consider what you have in place for onboarding. That is very important. And keep in mind, onboarding should be separate than orientation. Those are two somewhat separate elements. Is onboarding them onto the organization, the beginning, kind of what that looks like as the initial start of employment. And then orientation should be considered over a longer period of time, not just a brief orientation, you're good to go, here's a few resources, reach out if you need any assistance. No, it's got to be focused on those first 3 to 6 months and even up to 12 months that that individual is working at your organization. See how things are going. Implement a 30, 60, 90-day checkup. See how things are going. Make sure spousal satisfaction is going well also, and not just provider satisfaction. That other piece is important. And also utilize your engagement surveys. See what your team members, your employees are saying. Identify those areas that you can work on, improve on, or grow upon. And compensation as well. Those are all important pieces in the retention of our healthcare providers.
Hey, Trixie,
Yes.
we have a question.
Okay.
I'll read it. It says, sorry, this was from a few slides ago regarding the Spanish immersion course that the Yakima Valley Farm Workers Clinic offers to the providers. Do you guys know if this is offered to other providers at outside facilities? If not, I can definitely reach out to them.
So I am not aware of the answer to that, but I bet it is something that could be looked into further for other organizations to utilize. If you want to reach out to me, I can put you in contact with the senior recruiter at Yakima Valley, and she might be able to provide a little bit more insight into that program that they have in place.
And Frank Betzer said, thank you for the CMH shout out. We're always trying to improve that page and would welcome suggestions.
You're welcome, Frank. Thanks for having it available that I could take a screenshot and share.
All right, that's it for now.
All right. Thank you, Sarah.
You bet.
All right. So I'm going to jump into a little bit about 3RNet and share a little bit of information about that program. So 3RNet is considered the nation's most trusted resource for health professionals seeking careers in rural and underserved communities. One of my favorite things for me as a recruiter in working with 3RNet in this role and outside of this role, I've actually worked within 3RNet for many, many years and have had a lot of good positive experiences. But one of my favorite things about 3RNet is those practitioners and providers that are registering on 3RNet kind of have a forefront understanding that it is focused on rural and underserved communities and opportunities and sharing those opportunities. And so in my mind, it breaks a little bit of that rural barrier than if you're signing up with a larger platform, where there's opportunities across the board. And then not so focused on that rural and underserved. And that's what I like about 3RNet, that it does have that focus. 3RNet, the way it is structured, it is represented in each state, and there is a state coordinator that manages the 3RNet platform for that state. And for Oregon, that is myself. To access 3RNet, it does not cost directly through 3RNet. They do not do not charge for 3R Net membership. But the way membership is structured for Oregon offers a different membership structure for 3R Net. And each state does it a little bit differently. By posting jobs on 3R Net, you have access to thousands of actively registered candidates. Um, we don't make cold calls. Every candidate has chosen to sign up for the program. And 3RNet is powered by the National Rural Recruitment and Retention Network. That's where the 3Rs, that 3 comes from, is for the 3Rs, rural recruitment and retention. Typically, 3RNet is supported by either your state office or by your rural health, your primary care association state office or rural health. And for the state of Oregon, it is obviously through our office. You know, some of the things I've really enjoyed with 3RNet over the last couple of years that I've worked with them directly is they are continually adding new elements and new initiatives to promoting 3RNet and to promoting those rural and underserved opportunities. This last year, they introduced called electronic badges, and this is so providers that are AHEC scholars, when they register on 3RNet, they can now attach an electric badge to their profile, you know, that they are a AHEC scholar, or maybe they are a certified professional through the National Association of Rural Health Clinics. That's also another electronic badge that providers can use on their profiles, which I think is great. And it shows how that involvement with these organizations is very important. I wanted to show a little bit to each of you our Oregon 3R Net State Impact Report. I went ahead and ran it for the past 12 months. So April 2023 to April 2024. This will give you a glimpse of some of the different activities that happen under all of Oregon sites and providers that have an interest in Oregon. But it gives you a pretty good glimpse of the activity, the involvement, the number of providers that are registered, number of job views, which is really amazing to me. If you look down here, it says how many times your jobs were viewed, over 636,000 job views in a 12-month period. So that, to me, that shows that providers, individuals are going back and back to job views, doing multiple views of these opportunities. So it is helping. It is a great program, and it can help reach candidates that are focused on rural and underserved. And then lastly, a few takeaways. I do have to give some time to my partner, Bill Funder, who I'm sure is just patiently waiting for me to finish talking. So we know there are no right ways to recruit and retain health professionals. If there was, we would all purchase the manual, and we would read the manual and implement that manual point to point. But there are best practices to implement so that you can have a better chance at success of recruitment and retention. And I want to just reiterate that our office is here to support you in all of those areas, no matter how small or how big it is. Whether you're unsure if it's something we can help you with or not, please reach out. I'm always here to help, at least to help market your opportunities. I keep track of those organizations' opportunities that I work with that aren't currently utilizing 3R Net. And that way, when I have providers that reach out to myself looking for opportunities, I can go to that source and I can say, you know, I've got a great opportunity in Baker City. I've got a great opportunity in Coos Bay, Oregon. So please, you know, reach out, let us know what areas you're struggling with. And remember, engage your community, keep them involved. stay, we have to stay competitive. We all know that with compensation. Be transparent. Be as transparent as you're comfortable with. Trust me, providers want to learn and know as much information upfront as they can. Promote your work-life balance. In a 2022 survey by Medical Economics, 85% of physicians stated that work-life balance is the most important factor when job searching. So look at how your organization is offering that and share that. Hire to fit. Look beyond the candidate's CV will allow you to identify if they are a good fit for your community and organization. Continue to conduct on-site interviews as much as possible. We know that's not always possible, and we definitely saw that over the last few years with COVID. Keep a strong social media and website presence, and partnerships. Partnerships, partnerships, partnerships. I wanted to share one unique thing that we are a partner of, or myself has been a partner of, and I wanted to make just a small shout out to the Southern Oregon Alliance of Physicians and Providers. This is a group of healthcare organizations in the Southern Oregon area that have formed a consortium together to try to recruit to their communities. And it's multiple organizations that have joined this alliance, and they have taken on a group, almost a group community focus on recruitment and retention. And it's been a really great joy to be a part of this partnership and to see what steps they're taking, what struggles they're facing, and what initiatives they're working on in their Southern Oregon area. And if you have any questions on that program, or if I can share information with you on that program, I'd be happy to do so. But it's just another unique approach on looking at how to increase recruitment and retention for an area of focus. And then lastly, just one last shout out to partnerships. Obviously our office, AHEC. AHEC is such a huge, important organization. Partner with your Oregon AHEC. Our Oregon AHEC works hard in our state, and I'm so proud of the many things that they do to promote education in our communities and rural communities. The Oregon Primary Care Association is also a very important association in our state. Northwest Regional Primary Care Association is also another good organization. And again, there's a number of different rural underserved specific job boards out there that can help you. And if I can direct you to any of those or offer additional resources, please, again, reach out to me and I will do my best to assist you. And again, thank you for taking time to listen to my piece of the presentation. And I am excited to hand off to Bill Funder, Program Manager of Incentive Programs.
Hello, everyone. Thank you so much. And well done, Trixie. Big round of applause for Trixie, everybody. And thank you for joining me. This isn't a background, by the way. This is actually my home. And the cool thing about it is I have a little elevator, and if I push this button, I can go into my sub basement where I've got water and all kinds of things, and then I can catapult back up. Why did I do that? Because it's silly. You just saw a middle-aged man on a Thursday at 12:40 do internet magic. You're not going to get that anywhere else but here, Office of Rural Health. So yeah, I am the incentives program manager and have been for longer than I'd like to admit here at the Oregon Office of Rural Health. And I oversee provider incentive programs, both funded by the state through the Oregon Health Authority. They get money from the Oregon legislature. They kind of hash out where they'd like programs to go, and then we implement those programs. We also receive funding from the federal government through the Health Resources and Services Administration, also known as HRSA. They provide us with grant funds and we implement programs. Next slide, please. So I'm going to talk about the programs as they stand now, and I'm going to talk a little bit fast because I could do an hour presentation on each one of these programs, but we don't have that kind of time, especially considering I wasted a precious minute acting like a fool. So, and I'm going to talk about where they are and where they're going, because there have been some really important changes that have happened over the last couple of months and some changes that will happen over the next couple of months. So the first program, Oregon Healthcare Provider Loan Repayment Program, is funded by the state of Oregon. And in order for a facility to qualify for this program, it must be located in a health professional shortage area or have a facility, HIPSA. And notice there is a big bold or and not and here. Or be serving Medicare and that really, it says and, but it should say Medicaid and or Medicare patients in no less the same proportion of such patients in the county. Meaning, so off the top of my head, I think Multnomah County has somewhere around, I want to say it's like 32%-ish OHP patients that exist in that county. But for instance, so Portland in Multnomah County, Portland isn't covered by a geographic HIPSA. But that doesn't mean that you can't access the programs. If you are seeing at least the county percentage that exists in Multnomah County, so as long as you're seeing that above 30 some odd percentage, if you're not located in HIPSA, you can still access our programs. And then there's another or there, provide essential healthcare services to an underserved population. Back one slide, please. I can do it off the top of my head if I need to, because I'm that good. But I'd rather not. But so we're not going back a slide. That's okay. Bill adapts. So the or in the, and now we're going forward. That's okay. We're going even further. We're going so forward. We've gone forward in time. I was looking to go back, but you can't go back in time. You can only go, well, we've just broken physics here. We've not gone back in time. That's okay. We do all kinds of miracles over here. Check this out. So provide care, provide care to underserved populations as deemed by the authority. And in this case, the authority is the Oregon Health Authority. And that allows us to do things like, okay, so you're not in a HIPSA, or maybe you are in a HIPSA, but you're a Veterans Affairs facility. Veterans Affairs facilities are going to see TRICARE. That's not Medicaid and or Medicare, but we want to support that. Okay, cool. Also, state and county correctional facilities, they have their own budgets for offering care to their inmates. And that's not Medicaid and or Medicare patients. That is an internal budget thing. We can allow for that. And clinics that see patients free of charge. So if you're seeing underserved populations or you're located in HIPSA, it's likely that there's an avenue for you to qualify as a site for this program. You must have a site application on file with our office that is no more than 1 year old. The site application process is quite easy. There's not a site visit involved. Most practice sites, especially if you have an electronic health or medical records system, takes about 20 minutes to complete. So it's 20, 30, maybe 40 minutes per year to have an active site application. But that one site application allows us to review your site for all of our provider incentive programs, our loan forgiveness and loan repayment programs. Next slide, please. So these are some recent updates to that Oregon Healthcare Provider Loan Repayment Program. So the loan repayment program, the Oregon Healthcare Provider Loan Repayment Program, offers providers who work in approved practice sites the opportunity to apply to have to receive state funds to pay down their medical education debt. And the maximum a provider can receive in exchange for a 3-year service obligation to the state of Oregon is $150,000 in exchange for a service obligation, and that is tax-free. So that is unlike a bonus, and that ties the provider to the state of Oregon to work in an urban or rural underserved community and or practice site. So recent updates. There for a while, the BHWI, the Behavioral Workforce Initiative over at the Oregon Health Authority. They were incentivizing behavioral health providers through a big injection of money that they received from the Oregon legislators to increase access to behavioral health care. They expended those funds. It was always intended to be a one-time shot in the arm. And so our programs on the state level stopped incentivizing behavioral health providers. And that was an attempt not to compete with that program. Now that those funds have been expended, there's been about almost a year and a half where state level programs weren't incentivizing behavioral health providers. But I'm happy to report that as of like last month, we brought back behavioral health providers into our incentive programs. And another big update that we have rolled out just recently is time spent as a preceptor can now count towards direct patient care hours. Our programs have requirements based on how many hours you work. You have to spend X amount of time doing direct patient care. And preceptorships have never, for the history of our loan repayment programs, has never counted. It now does. So preceptors, you can now apply to our programs. What about, there was a question that just popped up and I'm checking that out. They're traditional health workers. So I assume by traditional health workers, you mean MDs, DOs, NPs, all those folks can definitely apply. All of those are still your traditional primary care workers, can absolutely still apply. We've just added behavioral, those folks who are engaged in behavioral health can now apply to the program. So still traditional physical health, absolutely. And then beginning this summer, 2024, which sounds like a made up number, we're approaching 2025, people. Blows my mind. Community health workers, we're getting to that. We're getting to that, Kate. I'm going to talk to you. We're going to talk about community health workers here in just a sec. I'm glad you brought that up. Nice priming the pump there. Beginning in 2024, we're going to expand into dental assistants and dental therapists, which is not something we've done before. We've always incentivized expanded practice dental hygienists, but we've never incentivized dental assistants and dental therapists. And that is going to be rolling out again later at the end of this summer. And then later in this year or early 2025, we are going to be bringing back one of our programs that went away when the BHWI got that big infusion of money, and that's the Oregon Behavioral Health Loan Repayment Program. And Katie, to your question, community health workers, peer support specialists, those people will be able, who are engaged in behavioral health, will be able to apply for that Oregon Behavioral Health Loan Repayment Program. We're likely going to call it something different, but it's going to be an Oregon-based behavioral health loan repayment program. So something around there it will be called. And that's going to allow for QMHAs, QMHPs, so your associate level behavioral health providers up to master's level. It's also going to take care of people doing inpatient behavioral health work, peer support specialists, things like that. You mentioned, Katie, in your as one of your providers, doulas. Currently, no, we do not incentivize doulas. We do have incentives for midwives, but we do not currently have doulas as a bullet point for a provider that we incentivize. But that can always change. And yeah, that may be an important thing to look at. Absolutely. And we do update our lists of providers, and it is based off of Oregon's Unmet Healthcare Needs Report and needs assessments. And that is one of the reasons why dental assistants and dental therapists are being brought in. And that's one of the reasons why we were able to make a really good case for allowing folks like QMHAs, QMHPs. So absolutely, in the future, that very well could be something that could be incentivized. And there was another question that came in. Are there any incentives to employers who provide behavioral health services such as internships and cost shares? Currently, no. All incentive programs, the funds really aren't going to the employer. They're going to the provider themselves. But as a practice site, you can, as Trixie mentioned, part of that marketing tool if you come to us, you fill out a site application, you can put on your postings that you qualify for the Oregon Healthcare Provider Loan Repayment Program, that you're a qualifying site, that you're a qualifying site for the Behavioral Health Loan Repayment Program, or for the Oregon State Partnership Loan Repayment Program, or a couple of the other incentive programs that I won't have time to talk about, but that do exist. So that benefit for you, it's not really a cash thing for practice sites, but it is a tool to market your opportunities. Next slide, please.
Hey, Bill.
Yes.
There is a question that came in privately to me, but I need your expertise. I'm not sure that was intentional. When an award is granted to a provider, are they able to disperse it towards their loans at their discretion? For example, use the award funds to make their loan payments rather than apply the award towards their loan all at once?
Yeah, so yes and no. The Oregon Healthcare Provider Loan Repayment Program, which I'm speaking about right now, it issues payments on a quarterly basis. So a provider will work for 3 months. And this program has a 3-year service obligation, as you can see here from this slide. So over the course of that 3-year service obligation, there are 12 quarters in 3 years, which means that provider is going to receive 12 equal payments over those 3 years. That provider is required to apply that quarterly disbursement directly to their approved student loans, provide my office with documentation that they've done so, and then the next quarter comes around, they are issued another quarterly disbursement. So they have a little bit of flexibility in the sense that once they get that check, they can, or direct deposit, they can absolutely apply that full lump sum, provide us with documentation, and then do that each quarter. The next program that I'm going to touch on, the Oregon State Partnership Loan Repayment Program, which is a 2-year service obligation, it pays all funds up front. So let's say you're awarded $50,000 through that program, it's going to shoot $50,000 right out of the money cannon straight at you, and then you can turn around and apply. You've got your 2 years service obligation to apply those funds to your approved student loans. I highly recommend that folks apply that full disbursement amount to cut down on interest so it's not accumulating. But that program allows a little bit more flexibility in how you go about applying those to your approved student loans. Hope that answered that question. So this program, I'm going to touch on it really quickly. Full-time providers, which is 32 hours of direct patient care, which includes preceptorship, and patient charting and anything that involves direct patient care, we can count towards direct patient care hours, medication management, X, Y, Z. So that is a 3-year service obligation, tax-free, of 70% of your qualifying educational debt, up to $50,000 per obligation year, meaning 3-year service obligation, $50,000 per obligation year equals $100,000. If you have less, so big update here, if you have less, $29,000 or less, we're going to pay off the entire balance. We're not going to worry about the 70%. So if you're at 29,000 or below, it's going to be 100%. And then part-time providers, again, 3-year service obligation, $25,000 per obligation year, so $75,000 max. And if you're part-time, which is 16 hours of direct patient care, you may receive, again, 15,000 or below, you may receive up to 100% of your qualifying educational debt. Next slide, please. So applications for sites and providers are accepted year-round, unlike the National Health Service Corps, which is a great program, but they have very strict site and provider application cycles. We're open all the time, 24/7. We are the 7-Eleven of incentive programs. What does that mean? I have no idea. We're open all the time. That's what that means. We've got great parking too, whatever that means to you. So yeah, you can come to us, knock on our door, submit a site application, submit a provider application. We make awards 4 times a year. So while we accept applications year round, we do awards on a quarterly basis. The current application, really I should say award cycle, because again, we accept applications year round. The current award cycle closes on July 11th, and those who make it into that cycle we'll likely hear whether or not they were awarded sometime in mid to late August, and they will have obligation start dates towards the end of the year. And then the provider application cycle after that closes September 26th. And so what's kind of cool about this program is a provider fills out an initial application. And then if they're not chosen in a particular award round, they can choose, we offer the ability to roll that application over into the next cycle. They don't need to complete a whole new application. They provide some updated debt documentation, and off to the races they go. And in fact, your odds actually increase the more times you apply. I'm not going to get a whole lot into that because we've only got like 3 minutes, so I'm going to keep moving. Right on to the next slide, please.
Hey, Bill.
Yes.
Quick question. Let's see. Does the OR program have the same service obligation formula as HRSA? Recently, HRSA told us that PTO, sick leave, and CME days are counted as missed days.
Yes. So yeah. So what we do have is, so I'm glad you brought that up. So someone must in these programs work 45 weeks out of a 52-week period. That allows a provider a total of 7 weeks off. CME days, clinic closures, holidays, sick days, all roll up into that allowed 7 weeks off. However, protected leave, something that would be covered under FMLA or a similar kind of Oregon FMLA-ish program, we can put that provider's obligation on pause. So if a provider experiences a life event, these programs do have some heart to them, and we can put an obligation on pause so the provider can experience that life event and either enjoy it or get past it, depending on what that life event is. And then once they return to their practice, they can restart their obligation. So yes, there is a number of required weeks that a provider must work, but that it does allow for life events that come up. And then there looks like another question came in. Can you address organization type, A, B, C hospitals? I'm in Coos Bay, and I believe our options are limited. The cool thing about especially the Oregon Healthcare Provider Incentive Loan Repayment Program, which I was just speaking about, it doesn't take designations into consideration. Type A, B hospitals, that's not really a consideration. Do you have a HIPSA, or are you seeing county percentages? If that equals yes, then and your providers, the provider themselves has to qualify or be eligible for the program. They have to be in primary care, seeing patients on an outpatient basis. They have to have qualifying educational debt. If all of those things equal yes, then you're good to go. So these programs aren't really concerned much with, are you an RHC, are you an FQHC, what type of hospital you are. So I hope that answers your question. And I've got like 1 minute to go, so I'm gonna really keep trucking here. But I promise you can always reach out to me. My contact information will be here at the end. Oregon State Partnership Loan Repayment Program. It's funded by the feds through HRSA. It has a 2-year service obligation where the other program had 3 for full-time folks. The part-time folks must commit to a 4-year service obligation, but they get the same amount of money. Next slide, please. We're going really quick here. Here's all of the folks who are all the folks listed here. One thing about this program, again, this program is handed down by the feds and requires that all people be master's level and above working in outpatient primary care settings. Next slide, please. So here's some things. The Oregon program was a little bit looser on qualifications for practice sites. The federal program, they dictate what it takes to be a qualified practice site. And here it is: nonprofit, must be located in a HIPSA, has to be doing all of these things. So all of these are ands and not ors like they were for the other program. Next slide, please. So you can get up to 2-year service obligation for full-time folks, $25,000 per obligation year, which means for a 2-year service obligation, the most someone can get is $50,000. You go, wait a minute, Bill, why the heck would I go for $50,000 when the other program offered 150,000. Well, the cool thing about this program is the other program, highly competitive. There's going to be an application pool, and X number of people will end up being awarded. With the Oregon State Partnership Loan Repayment Program, this program, it's a first come, first served basis. We get our federal funds on 9/1 of each year, and we keep making awards until those funds have been exhausted. When do those funds get exhausted? Depends on how many folks apply. But I can tell you right now, the program has money, like today. Like today. Apply to the program. It's a first come, first served basis. Get your site qualified. Apply to the program. It's money. Next slide, please. Loan forgiveness. So we have loan forgiveness opportunities. You can apply through our site application and have access to these students. Like Trixie said, these students are graduating right now. Freshly minted dentists, doctors completing residency, NPs, PAs, pharmacists who graduated in May are currently looking for positions through these jobs. And if you're a qualifying site, you can have access to not only sending your postings out to these people, but as these people go to look for jobs, it's good to know whether or not, before they go looking at your job, whether or not you're going to qualify for their obligation. And so at any given point in time throughout the year, right about this time, we've got about somewhere between 30 and 45 people all itching to find jobs who qualify for their obligation. Next slide, please. So we've got an insurance subsidy program, and we're over time. I'm just going to let you know that it exists and check it out. Next slide, please. And we also have tax credits. So you could be taking advantage of a tax credit as a provider and receiving a loan repayment through a loan repayment program and taking advantage of an insurance subsidy program. Wow, what a package that is. But you can only be participating in one loan repayment program at a time. So for instance, you can't go for the Oregon State Partnership Loan Repayment Program and the Oregon Healthcare Provider Incentive Loan Repayment Program. You can, as a provider, you can apply to both, but you can only accept the one program. That once you sign with a program, you have to stick that out. But once you've completed that program, you can go apply to other programs. We absolutely have had people float between programs and knock out all, if not a majority, if not all of their debt. Next slide, please. And that's it. Very fastly spoken on a so I only went 3 minutes over. That's my contact information. I really appreciate y'all being here. I've got a whole nother presentation that I've got to get to, so I will bid you adieu for the afternoon.